Welcome. I'm Dr. Gordon Saxe, and today we're going to be talking about how to achieve your ideal weight. Obesity has been steadily increasing in prevalence for over 30 years and is a risk factor for almost every major chronic disease: heart disease, cancer, diabetes, and many others. Obesity is usually defined on the basis of a body mass index, or BMI, a measure of weight that takes height into account. A BMI of 25 to 30 is considered overweight, and over 30 obese. Obesity is now reaching epidemic proportions in which over a third of the population in many states have BMIs over 30. Many people believe that obesity is genetic, and that no matter what they do, they can't lose weight, unlike, say, some very lucky skinny friend who can eat anything they want without gaining a pound. While it's true that some groups are more susceptible to weight gain and obesity, such as the Pima Indians, a Native American tribe in whom obesity rates are especially high, the truth is that these groups never suffered from rampant obesity until recently. And if obesity were largely a genetic condition, why has the rate increased so dramatically in such a short time span? The answer isn't that people's genetic makeup suddenly changed overnight. It's that the food supply did. We've seen the introduction of more and more convenience and junk food. There's also been a huge increase in use of added fats and refined carbohydrates, trans fats, and high fructose corn syrup in particular. But the good news is that obesity is almost completely preventable and reversible through a change in diet and lifestyle. I'm not saying it's easy. Making a sustained and comprehensive change in diet and lifestyle takes determination. Part of what makes it hard is the ready availability, everywhere you look, of tempting but obesity-stimulating fast, convenient food. But more and more people are recognizing that the emperor has no clothes, that the Western diet is killing us, and as a result, there's an undercurrent of healthy changes that we can draw on to help us make our own changes. If you're overweight and adopt a whole food plant-based diet, I predict you'll begin moving almost effortlessly toward your ideal body weight, without having to deprive yourself, go hungry, have your stomach stapled, or exhaust yourself like a rat on a treadmill. And I'm going to bet that you're going to look and feel so much better that you may never want to return to your old ways. No major chronic disease is more strongly linked to obesity than type 2 diabetes. Type 2 accounts for 90% of cases, and type 1, which we usually only see in children, the other 10%. Almost 1 in 10 Americans now suffers from type 2, or what used to be called adult-onset diabetes. But now we're seeing it even in children. And according to recent statistics from the National Institutes of Health, about 35% of the overall population and more than half of those over age 65 are considered pre-diabetic. In type 1 diabetes, the problem is that the pancreas isn't producing enough insulin, the hormone that regulates blood sugar, also known as glucose. In type 2 diabetes, insulin production is normal, but the cells in the body resist the insulin, and glucose backs up in the blood, becoming toxic to the tissues of the body and causing secondary health problems that may include blindness, kidney failure, heart disease, nerve disorders, infections so severe they sometimes require amputations, and early death. We've known for years about the correlation between obesity and diabetes, but the explanatory mechanism has been unclear. Many researchers now believe that what's responsible may be the accumulation of what are called intramyocellular lipids. Allow me to explain. When we take in too much sugar, the body converts it into fat for long-term storage. When people are obese, they tend to accumulate fat everywhere in their bodies, even within the cells themselves. This intracellular lipid accumulation, literally fat inside the cell, seems to be telling the body that it has plenty of stored energy. It's as if the cells are crying out, please, I can't handle any more sugar. Keep it where it is, out in the blood. Interestingly, type 2 diabetes, again, more than 90% of all diabetes cases, typically respond quickly, sometimes in just a few weeks, to a whole food plant-based diet and its accompanying weight loss. And for those who are well, the risk of contracting type 2 diabetes may disappear almost completely. Heart disease, or more precisely, heart attacks caused by atherosclerotic blockages in the coronary arteries that feed the heart, is the leading cause of death in the Western world. For many years, it's been recognized that heart disease is caused, in the vast majority of cases, by the high-fat, high-sugar, standard American diet, as well as stress, lack of exercise, lack of social connection, and smoking. Now, high cholesterol and high blood pressure do play a role as well, and treating these with drugs can slightly reduce the risk. But these factors are themselves manifestations of a poor diet and lifestyle. And in the last several years, it's been increasingly recognized that obesity is also a major risk factor. Even a modest 5 or 10% reduction in body weight can have a huge effect, greater than that of many medications, on cholesterol, blood pressure, and one's overall risk of heart disease. And it's been well documented by Drs. Dean Ornish, Caldwell Esselstyn, and other researchers that adoption of a whole food plant-based diet, reinforced by other lifestyle changes that are part of natural medicine, can over time drop body weight, cholesterol, and blood pressure, gradually melt away blockages in the coronary arteries, and dramatically improve overall circulation and blood flow to the heart. Now, cancer is the second leading cause of death after heart disease, and 1 in 4 of us will contract it in our lifetimes. And that's not even including skin cancer, which, although usually not life-threatening, will alone affect 1 in 3 of us. This is a scary thought, and cancer is a scary disease. Yet in spite of billions spent in the war on cancer over the past 30 to 40 years, we've made only marginal progress in preventing or treating the major cancers, such as lung, colon, breast, prostate, and so on. But in a huge landmark study a few years ago by the American Cancer Society, it was determined that obesity was a risk factor for almost every major cancer. Now, it may be true that cancers develop because of abnormalities in our genes. In some cases, we may inherit a bad gene. In others, there may be damage to a normal gene that converts it into a bad gene. Or something may happen that switches on bad ones or turns off the protective ones. But in many of these cases, far more than we've previously realized, poor diets, sedentary and stressful lifestyles, and excess body weight may be the gasoline that gets placed or poured on the fire. Fat tissue in particular is the site where various tumor-promoting hormones and immune-suppressing inflammatory molecules get produced. Not surprisingly, even after diagnosis and treatment of many types of cancer, the odds of recurrence and early death appear to be substantially higher in those who are obese compared with those who are lean. This seems to be particularly true for some of the most common cancers, colon, breast, and prostate. And there's also growing evidence that adoption of a healthy diet, exercise, and weight loss may not only help prevent relapses of certain cancers, but in some cases may even help slow, stop, or reverse cancer even after it's spread. According to the Centers for Disease Control, 1 in 5 adults in the U.S. has been diagnosed with arthritis, inflammation of the joints, and while it may be mild in some people, in others it can be debilitating. The 2 main types of arthritis are osteoarthritis and rheumatoid, and of the 2, osteoarthritis is far more common. It accounts for about 85% of cases. Now, both types are linked to body weight, but by different mechanisms. Osteoarthritis, also known as wear and tear arthritis, occurs when there's too much stress on a joint, such as excess body weight bearing down on the hips or knees, leading to inflammation, swelling, and pain. Rheumatoid arthritis is an autoimmune disease, but it's also made worse by obesity. And again, that's because fat tissue is the site for production of inflammatory molecules that can act on the joints and worsen the inflammation. But the good news is that both types of arthritis can be improved and symptoms lessened by the weight reduction that occurs naturally when those who are overweight or obese adopt a whole food plant-based diet. We all have lots of reasons to achieve our ideal body weight. We'll look and feel better, lower our risk of disease, and save money on our groceries, our clothing, and our healthcare expenditures. So what causes us to gain weight or prevents us from losing it? I would argue that an important factor is not just how much food we consume, but the type of food. You can eat all the steamed vegetables you want and you won't gain weight. You might even lose it. But if you eat just a few fatty, meaty, sugary junk foods like candy bars, pizzas, cheeseburgers, French fries, soft drinks, you'll pack on the pounds. So what do we need to do to lose it? Here are a few helpful tips. Become aware of when and why you're eating compulsively or mindlessly. Eat only when you're hungry, not when you're bored. Don't eat under stress or when you're standing up. Take time out to calm and relax yourself before you eat. Savor your food. Eat it slowly. Chew it well. Try putting your fork down between bitefuls. And also try to avoid eating a large meal late in the day, and particularly avoid eating within, say, 3 hours of bedtime. If you must, if you're really hungry, try something light, like herbal tea and a rice cake for a midnight snack. I learned as a child to clean my plate because of all the starving children in the world, as if somehow, if I didn't waste any food, it would somehow magically feed them. Well, sorry, Mom and Dad, but maybe that wasn't the best advice. A much better idea is to start off with a smaller amount on your plate in the first place. Another tip is to avoid eating past the point of fullness. Stop when you feel about 80% full. Most likely your body still needs time to register the food that you've already eaten. However, I have to share with you the truth about eating a whole food plant-based diet. It can be summed up in 4 words. Eat more, weigh less. That's right. Even eating as much as you want, or even overeating a bit, you'll still find that the extra pounds melt off. Next, don't put yourself in social situations that cause you to overeat, such as all-you-can-eat restaurants. And be careful of the company you keep, not only in your living room, but in your refrigerator. You'll likely eat whatever is in there and is most visible for you to see. There are innumerable weight loss diets out there and gimmicks galore, but one sure and time-tested path that I've shared with you today will not only help you lose the excess weight, but perhaps, even more importantly, maintain or restore your health for a lifetime.